Welcome back, guys. We're talking about the respiratory problems and, as promised, lung cancer. Again, usually cigarette smoking is involved, or some sort of foreign airway getting in there and affecting the lungs. Usually, we find this between 55 and 65 years of age. 20% are involved in the lung tissue only. 35 of it actually spread to the lymphatic system. 45% has distant metastasis. Metastasis is when those tumor-like fingerling go out and begin to spread out. And if I go back to that slide that I said I wasn't going to go to, again, these extended white things here is metastasized tissue. Back over here, metastasized tissue. Metastasized tissue. So it's not just as simple as going in and just taking out the tumor. I wish it was that easy, okay? As a matter of fact, usually when they open those people out and it's metastatic in nature, once you open these people up and they get the air, the metastasis just goes at an exponential rate. Don't know exactly why. Environmental exposures to asbestos, hydrocarbon, radiation, cigarette smoking, home exposure to radon, all of these things can lead to risk factors, okay? But primarily caused by cigarette smoking, kind of the big one. So adenocarcinoma is the most common type. Adenocarcinoma. Adenocarcinoma is a tumor on top of the kidneys that produce epinephrine. This adenocarcinoma is the granular type that's found in there. This is adenocarcinoma. The small cell or the oat cell carcinoma is where it affects the bronchial tissue. Epidermoidal carcinomas actually affect the bronchial tissue. And the large cell carcinoma is the bronchial tissue as well. Not that any of them are good to have, but if you were going to have them, this guy's probably the better one to have, I would say. Usually most patients die within a year of diagnosis of these. Again, address the signs and symptoms of the severe respiratory distress. I know that my grandfather had this, and one of the things was when they started treating him with radiation, he ended up getting lung burns because of it, and it kind of destroyed tissue, where we actually had to go out and treat him and provide a supplemental oxygen therapy and give him bronchodilators so that he could breathe, okay? Severe controlled hemoptysis can be life-threatening. So what happens is the tumor grows to the point where it breaks one of the major arteries or breaks the pulmonary supply, in which case the blood starts coming into the lungs, in which case, of course, they start coughing up blood. Hoarseness, vague chest pain, and hemoptysis, kind of a common thing that happens with our lung cancer patients. The metastatic symptoms, they start to develop seizures. They start getting headaches, bone pain. It goes down into the abdomen, nausea, malaise, and a profound weight loss, okay? Cashexia is the breakdown of muscle tissue. The severe breakdown of muscle tissue, so the wasting away effect, if you will. Again, rhonchi-breathes diminished lung sounds. Again, administer supplemental oxygen on these patients. Look for that DNR living will. Follow your local protocol involving this. Most of these folks have advanced directives as to what they want done. When in doubt, contact medical direction. I'm pretty sure they're going to probably side with the fact of, hey, we're not going to prolong this person's suffering. Where, again, supplemental O2 is probably your best thing. Comfort care measures, okay? And again, normal saline if they are dehydrated. And about indwelling catheters, you're probably going to end up having to access one of those. Most of the time, these guys have a Huber port placed in. Again, we don't place a Huber port unless we've been specially trained in which to do so, okay? Toxic inhalations, usually causes pain, inflammation, irritation, and you should consider that in any patient that's having sudden onset of shortness of breath and they can't really figure it out. Superheated air, by the way, steam, chemical irritants, toxic products, all of these, they not only cause irritation on the way down through, but they actually damage the alveolar tissue, cause a lot of leakage into the back of the area, okay? It depends on which way it's going to be as far as the capacity in which they're doing it. So again, severe inhalations can actually affect those membranes. And you got to determine what it was or the combustible material if you actually can. And the other thing is you get a formation of corrosive acids or alkalis, especially when you mix stuff, especially when it then gets into your lungs. I know sulfur dioxide and sulfur trioxide will actually, once they get into the water inside of your lungs, they will actually start to form acids down there. Chlorine does the same thing. Basically, you're putting hydrochloric acid in your lungs when you breathe chlorine. Or good for heaven forbid you mix ammonia and bleach together, forms both ammonium hydroxide and hydrochloric acid, which then you inhale, which makes everything worse. So again, try to determine what it is, and again, don't go rescue them if you're not making sure that everything is clear for that. Pay attention to the face, mouth, and throat. Look for burns. Look for wheezing or crackles that appear, okay? And the biggest thing is if you've got a burn injury, secure that airway, secure that airway, secure that airway, okay? Because it's going to heat up on you, okay? Now, carbon monoxide inhalations. The odorless, tasteless, but the problem is it binds to our hemoglobin many times more than it will bind than oxygen does. So basically, it makes the hemoglobin molecule useless, okay? And once this happens, it doesn't like to let go, all right? So it causes hypoxia at the cellular level, okay? And unfortunately, they end up with metabolic acidosis because of it. And again, determine how long they were exposed, where they were exposed at, how long have they been breathing that stuff, how much was the concentration if you can find that out. Again, it might be mild symptoms, a headache, a little bit of nausea, confusion. Remember, guys, if you've got a carbon monoxide area and you go into it and the concentration's high enough, you can literally walk in there, lose consciousness, and die, okay? So, again, bright cherry red skin or cyanosis, I will tell you, is usually a late sign. The bright cherry red skin, very late sign, okay? So, again, they'll put that on the test, but, again, very late sign. When you're seeing that, you already should know that you're in trouble, okay? So, again, carboxyhemoglobin is, you should measure those through carbon monoxide oximetry, again, using your the meter for that, okay? And that, by the way, that can detect carboxyhemoglobin, ethylhemoglobin, oxyhemoglobin, deoxygenated hemoglobin, and actually how much hemoglobin they truly have, okay? So make sure that you use that monitor the way it was built to be used, okay? Again, if you're doing that, make sure that you are safe in order to effect the rescue. Administer high concentrations of oxygen, and you need to be thinking if it's CO poisoning, you really do need to be thinking where's the nearest hyperbaric chamber, because that's going to speed it up. CPAP can also help. Again, it supports ease of breathing, and again, be thinking about a hyperbaric chamber. Okay, I know where it says it remains unclear. I've seen it work too often. So again, and I've taken patients down to these places where they can actually function and be useful. All right, we are going to hold off on the pulmonary embolism because that's the next one, and I will see you then.